38-year-old woman, what's the diagnosis? When you're looking at joints that look this degenerated or this difficult, it's hard to know where to begin, but it always begins with the joint space. So let's take a look. As we look on this frontal and lateral view of the x-ray, we can appreciate the concentric joint space narrowing that's occurring all throughout the articulation. Really concentric and homogeneous and symmetric. There's very little osteophytes to go along with this amount of narrowing. The person's hand. We can see in this case we have concentric diffuse joint space narrowing characterized by erosions and some minimal bone formation in this patient who is suffering from rheumatoid arthritis. This is a late stage case of rheumatoid arthritis where you're seeing joint space narrowing, osseous fusion at the wrist, MCP and PIP joint space narrowing, and very little bone production to heal. With regards to percentage of bone mineralization that must be lost before you see it on x-ray, is it A, 10 to 20%, B, 30 to 40%, C, 50 to 60%, or D, 70 to 80%? What do you think? Up to 30 to 40% are lost, and we can see in this patient who suffers from rheumatoid arthritis, the early bone erosion appreciated along the head of the metacarpal in this patient who is osteopenic. It would take about 30 to 40% of the mineralization to be lost to even appreciate this on an x-ray. So it's rather later in the course of the disease.